I'm Scott Galey, and I'm a total joint surgeon specializing in hip and knee replacement. I grew up in medicine with my father teaching in a medical school, and my mother was a primary care doctor. But I was also drawn to engineering and mechanics from a very young age. I went to Stanford University where I got my biomechanical engineering degree. And then I continued my training at Cleveland Clinic where I went to medical school. And I fell in love with orthopedics, and I ended up going to UCLA for orthopedic surgery residency, followed by the Cleveland Clinic, Florida location for a year specializing in hip and knee replacement. My favorite part about being a physician is really the longitudinal relationships that you get to develop with folks, and really the difference that I'm able to make in their lives, both through surgical and non-surgical treatments. And just seeing people get better is what really drew me to orthopedics, and I think our field is uniquely positioned to really make very quick and acute differences in people's pain and function and really get them back to the activities they love, and that really brings me a lot of joy. I grew up in Albuquerque, New Mexico, where I had easy access to the mountains and the outdoor lifestyle. Did a lot of skiing, hiking, fishing, camping when I was young. Unfortunately, through my training, I got taken away from it a little bit, and I really wanted my children and my family to have that access to that lifestyle. And luckily, the Fort Collins and kind of Front Range area really offers that. And I'm just so excited to kind of get back to hiking, fishing, camping, having quick access to the mountains, and just enjoying myself and having my girls grow up in the outdoors. What really drew me to OCR, first and foremost, was the excellent physicians that are part of the group and that I'd be able to work with every day. And secondary to that, I thought that OCR had been a stalwart in the community for a long time and offered a lot of fantastic community outreach projects through their rodeos and sporting events, as well as their involvement with nonprofits. By being engaged in a lot of the same activities that my patients are looking to return to, I can understand the challenges that would come from being limited from hip or knee pain. If you're trying to get back to hiking, get back to golfing, get back to pickleball, get back to ranching, whatever it might be, when you can relate to people and understand what they're facing when they're trying to enjoy themselves and enjoy their lives, I think it leads to a deeper physician-patient understanding and better outcomes. My mother is a Cuban refugee, and I grew up speaking Spanish and English, and I'm looking forward to seeing and treating our bilingual and Spanish-speaking communities here in the Fort Collins, Greeley, larger area. If you're experiencing hip or knee pain, I look forward to seeing you in my office and doing my absolute best to get you back to moving like you used to.